Welcome to your Health Oasis, your complete healthcare guide. The cyclical events that take place during the reproductive period of a woman's life is called menstrual cycle. After menarche, apparently, the body of a girl beautifully prepares her uterus every month to nurture a baby. When that does not happen, the girl starts menstruating the next month, and this cycle goes on and on till her menopause. As a result of which, she bleeds for 2 to 7 days a month, which is sometimes or almost always associated with a cruel pain which we have named menstrual cramps. Painful periods, also called dysmenorrhea, is a cramping pain accompanying menstruation. Let us first understand in brief about the pathophysiology of menstrual cramps before we proceed. The maturing follicles in the ovary secretes estrogen, which aids in the building up of the uterine endometrium. After ovulation, the corpus luteum in the ovary secretes progesterone that promotes the secretory activities in the endometrium. The regression of corpus luteum in the ovary leads to sudden withdrawal of progesterone, which then causes local release of prostaglandins. Prostaglandins are responsible for increased uterine muscular contractions and menstrual cramps. Painful periods or dysmenorrhea can be classified into two groups, primary and secondary dysmenorrhea, for a better understanding. Primary dysmenorrhea is the one in which there is no pelvic pathology involved, which means there is no abnormality in the uterus, ovaries, fallopian tubes, or the adjacent pelvic structures. It occurs as a part of biochemical derangement, which is due to increased secretion of prostaglandins. It affects the women of younger age group of about 15 to 25 years and is particularly seen in young girls 1 to 2 years after the onset of menarche. The pain experienced is almost always a spasmodic type of pain. On the other hand, secondary dysmenorrhea occurs due to some pelvic pathology, which we will be discussing in detail. It is more prevalent in elderly women, and the pain associated is a congestive type of pain. Let us now see the most common causes of secondary dysmenorrhea. We have initially seen that secondary dysmenorrhea is more prevalent in older women, but endometriosis, being an exception, is one of the leading causes of dysmenorrhea in women of all age groups. Endometriosis is the occurrence of ectopic benign endometrial tissues outside the cavity of the uterus. Adenomyosis is a condition in which islands of endometrium are found in the wall of uterus, causing painful uterine contractions. It is also one of the major causes of abnormal uterine bleeding. Pelvic inflammatory disease is the inflammation of the upper genital tract involving the fallopian tubes as well as the ovaries. There may be high-grade fever, vomiting, dysuria, that is pain while urination, and also excessive leukorrhea associated with pelvic inflammatory disease. Women using intrauterine contraceptive device such as COPD commonly experience increased menstrual cramps along with backache. Cramps are a common side effect of intrauterine contraceptive device usage. Uterine fibroids, polyps, or even ovarian cysts could lead to painful periods along with an increased menstrual bleeding. Bicornuate uterus is a rare congenital anomaly that could cause excessive menstrual cramps and also lead to irregular menstrual cycles. Women with bicornuate uterus are at an increased risk of miscarriages. When your period pain becomes unbearable, which does not settle down even after taking 2 to 3 painkillers a day, and that comes along with some associated symptoms, you must consider visiting a doctor. The associated symptoms involve nausea or vomiting, headache or lightheadedness, giddiness or fainting episodes, backache, and some women may also experience diarrhea. Kindly consider to like, share, and subscribe the channel if this information was useful to you, and do not forget to hit the bell icon. Follow me on Instagram for some daily healthcare tips. Thank you for watching.